Hi, my name is Dr. Les Ruppersberger. I'm a retired board certified NFP only OBGYN. I'm the past president of the Catholic Medical Association in 2015, and I'm the current president of the St. John Newman Guild of Philadelphia. And I'm here to answer a question. Will you hear everything you need to know about abortion in medical school? My answer is no. I answer this question with you with multiple factual information, and you can access the information further from a talk I give annually at the boot camp to medical students. Abortion is the killing of a baby. You will not hear that in medical school. You will not hear that it is the killing of preborn human being. You will not hear that 1 out of 4 women will have had an abortion by age of 45. You will not hear that there are approximately 1 million abortions in the United States performed every year, and these are only surgical abortions. You will not hear that there have been 61.2 million surgical abortions that have been performed since 1973 and the passage of Roe v. Wade. You will not hear that there are over 1.5 billion, with a B, abortions that have been performed worldwide. You will not hear that 37 states in the United States require parental notification before abortions. You will not hear that there are 41 states who require the abortion to perform by a physician, meaning that in the other states, the surgical abortions can be performed by physician extenders such as nurse practitioners or perhaps even physician assistants or nurses. You will not hear that 27 states have a waiting period, that 5 states mandate a discussion about the risks of abortion increasing the risk of breast cancer and the link between those two. You will not hear that 13 states mandate a discussion on fetal pain. And you will not hear that 45% of women who have one abortion become repeat aborters. You will further not hear that there is an increased risk of breast cancer. Normally and physiologically during a pregnancy, if it goes full term, the breast tissue will be stimulated by the hormones of pregnancy, both estrogen and progesterone, but predominantly estrogen, to translate from a type 1 lobule to a type 4 lobule, which will be the most mature form of that breast lobule in preparation for breastfeeding after the delivery. If the pregnancy is terminated prematurely, usually documented prior to 32 weeks, then that full maturational process does not completely evolve, and the breasts are arrested in a type 2 to type 3 lobule where the breast tissue cells continue to proliferate. This proliferation over a period of lifetime in the presence of estrogen will eventually cause mutations in these cells and lead to the development of a breast cancer. So having a mature full-term vaginal delivery or even by C-section will allow breast tissue to develop through its normal maturational process, and terminating that pregnancy earlier can end up leading to an increased risk of breast cancer. You will not hear that there is an increased risk of preterm delivery. And there are 2 aspects associated with this particular problem. One is that there can be damage to the cervix during the surgical procedure, which can lead to the pregnancy being delivered a little bit earlier. And 2, that premature delivery then, as I had just recently mentioned, can lead to an increased risk of breast cancer because the breast lobules did not go through their full maturation process. There's also an increased risk of PTSD, depression, and psychological issues that are addressed by multiple organizations, especially Rachel's Vineyard and Project Rachel. These women suffer a lifetime of anxiety, depression, and emotional disorders. It can lead to psychological behavioral issues associated with drug use, increased risk of smoking, increased risk of promiscuity, and an increased risk of eating disorders, and even occasionally some suicides. This is a well-documented aspect in the literature and is not usually discussed in medical schools. You will probably not hear anything about the increased potential risk of mortality, where the death rate is approximately 1 out of 100,000. Even though this sounds low, when you take a look at the 1 million surgical abortions that are being performed in the United States, any loss of life, whether it's performed by a physician or not, is not acceptable with any surgical procedure. You will not hear a discussion on the lack of informed consent, because the majority of these issues of which we're making reference are not discussed. And if they're not discussed with the patient prior to the actual performance of the surgical procedure, then these patients are not getting fully informed consent for this particular surgical procedure. You will not hear an active discussion in medical school about how abortions are performed. You will not hear the technical aspects. You will not see a video of first trimester and second trimester abortions. You will not see a demonstration or a physical representation of the instruments that are used during abortion, the dilators that are used, the clamps that are used, the suction curettage machines that are used will not normally be demonstrated in a classroom and will not normally be revealed unless you actually go into the operating room during one of your clinical rotations to actually observe an abortion procedure. In medical school, you will not hear an emphasis on a discussion of fetal anatomy and physiology and an emphasis on when the fetal heart starts beating or an emphasis on when the fetus actually starts feeling pain. You will not hear any discussion about an increased risk of cervical cancer, where there is a 2 to 3 times increased incidence of cervical cancer associated with one abortion because of damage to the very early young cells that are going through a process of metaplasia at the squamocolumnar junction, and the damage, inflammation, and scar tissue that's taking place in the cervix as a result of instrumentation very early in pregnancy. You will not hear anything about an increased risk of placenta previa, which can lead to hemorrhage, which can lead to preterm delivery, which can lead to an emergency cesarean section. It can lead to maternal problems, and it can lead to fetal problems. This particular increased risk of placenta previa is associated with damage and scar tissue to the lining of the wall of the uterus that continues to persist. And so the placenta in future pregnancies does not have an appropriate place to implant and may present or implant lower in the uterine segment, leading to a placenta previa. You will not hear a discussion in medical school about the increased risk of pelvic inflammatory disease, which is an infection as a result of a complication during the abortion. There are many women who have abortion surgical procedures who are not screened prior to the procedure for chlamydia and gonorrhea, and instrumenting from the lower uterine reproductive tract to the upper can spread the infection, lead to damage, which then increases the risk of infertility and increases the risk for future ectopic pregnancy, which is the #1 cause of maternal mortality in the United States from a ruptured ectopic tubal pregnancy. You will not hear a discussion in medical school about the 10% rate of immediate postoperative complications, some of which we've made reference to already, that being infection, that being bleeding or hemorrhage after the surgical procedure, that being of embolism, especially amniotic fluid embolism, which has an extremely high mortality rate. You will not hear about perforations of the uterus. You will not hear about anesthetic complications. And you will not hear about cervical injury, which we've already alluded to, which increases the risk of preterm delivery. We've already discussed, and you probably will not hear a lengthy discussion in medical school about the link between abortion and behavioral changes, but especially you will not hear the numbers that 30% of all surgical abortions in the United States are performed in teenagers as early as the age of 12. And so these young patients don't even have a completely mature anatomy. They end up conceiving. they end up going for a surgical procedure, and they end up with damage and complications at their very young, immature ages, both psychologically, sociologically, and physiologically, which is an exacerbation of the complications that we've already discussed. You will also not hear a discussion on the incidence or the risk of sexual dysfunction, which ranges in the area of 24% as documented in peer-reviewed literature. And you will not hear a lengthy discussion about when life actually begins, which is actually when the egg and the sperm come together and the gametes form a zygote, and all of the DNA of that human being is present and will exist throughout the entire lifetime of that particular individual, with all the determinants and all the characteristics of all of its anatomy, physiology, and all of its psychological and social preferences and implications that are determined by DNA. There are many discussions that take place in medical school. There are many classes that happen in medical school. There are many issues that come up in medical school, and abortion will be taught. At my alma mater, one of the medical schools, I used to follow a class that was on abortion. I taught the class following it on natural family planning. And I used to arrive early and hear the professor that was teaching the class, which was a board certified OBGYN, who was actively performing abortions in his practice and espousing all the good things and all the positive things that are associated for what abortion does for women's health care. Well, I think that the presentation of the things that I've just recently discussed with you will tell you that abortion is not women's health care. I will further add to the list of things that you will not hear that there are probably somewhere in the neighborhood of about 300 to 500 million medical abortions as determined by the Catholic Pharmaceutical Association in the United States, because the IUD and the hormonal contraceptive also have post-fertilization effects that can lead to early pregnancy termination / abortion. And you won't hear about those either. So I hope that this helps you understand a lot of things that you may not hear about abortion in medical school. If you have any further questions, you can contact me through the Catholic Medical Association, and I'll be more than happy to answer them. Thank you and have a blessed day.